Good evening, everyone. Hopefully, you can all hear me on this live stream where we'll be taking you through a seminar titled AC Interview in Brisbane. This is another GradReady seminar, and this time we'll be tackling the interview process to get into medical school. I'll talk a little bit more in a moment, the outline of the seminar this evening, as well as your wonderful presenters. So firstly, we just a quick outline of what we'll be doing tonight, hopefully just going for about an hour or so. These are the main points we're going to try to cover. Firstly, the different types of medical school interviews, so the MMIs versus the panel interviews, as well as with obviously, a particular focus on the Queensland medical school interviews. So we're going to talk about, maybe the ideal candidates that medical schools would be looking for, different question types and formats you might encounter, as well as, how to prepare for the interview in general. And I'll be keeping an eye on the Facebook stream as well. So if you have any comments for any of the presenters, please just post them up there and we'll do our best to get to them as well. So next slide, please. So just very briefly, just to introduce ourselves, I guess. My name is Elliot. I'm the lead humanities tutor at GradReady and have also been running the interview ready courses that we hold for the last 4 or 5 years or so. I graduated Griffith Medical School in 2015 and did an internship at Prince Charles in 2016. I also graduated law that year, and I currently do a PhD in political economy down in Melbourne, which is where I am now in the heart of the lockdown. So, and I'll hand it over to Tanmay.
Hey guys, my name's Tanmay and I'm in my first year of medicine at UQ.
Wonderful. So yeah, we're both your presenters for this evening. So again, please feel free to throw up any questions that you have for us on the Facebook stream. So I think they're just starting out with really basic principles of what the medical school interview about, which I think is maybe not really much of a mystery to anyone, is that it's used to select, the so-called bright students for the medical program, especially for the Queensland schools where you have to go through the GAMSAT. This is yet another filter to narrow down, the students who will eventually accept a medical school place for the next year. And we'll be showing some information a little bit later, which gives you an idea of the weight of the interview score in terms of the overall percentage of, or I guess the overall weight of the application process to get into medical school. So maybe just to rephrase that a little bit more eloquently, I'll be showing you some data soon where it indicates, how important the interview is at each medical school, because sometimes, it maybe is weighed up, is worth like 50% of your total score to get in medical school. Sometimes it might only be 30% or so. And there's different types. We have the multimodal interview, the panel, and group interview as well. I think we'll mostly be focusing on the MMI this evening because this is predominantly what is being used for a lot of the Queensland universities, although there'll just be some brief comments about the panel and the group interview as well. So I'll just take you through just some more of the basic aspects before we have some more, I guess, engaging discussion between Tanmay and myself about the, what the interviews look like at each medical school and how best to prepare for them. So the multi-mini interviews basically a rotation through 5 to 10 stations. So I don't know if anyone has seen this TV show, or I'm just showing my age, but there was a show maybe in the early 2000s called Thank God You're Here, or something along those lines. And, the contestants would kind of like pop into a room and they'd have to act based on the situation that they found. And so for me, the multi-mini interview is very much like this kind of TV show where you go through maybe 5 to 10 situations in different rooms, and you can really kind of, go into anything. And we'll talk about what kind of situations might be waiting for you there a little bit later on. So usually there's a scenario presented at each station, and you have usually 5 minutes per station as well. And normally for a lot of medical schools, and it does vary, you might have a couple of minutes of preparation outside a station where you might be able to read, an overview of what's happening in the station that's upcoming. You'll have 2 minutes to read, and then you can go in, for example. But we'll provide some data on what medical schools have, what kind of preparation and station times different medical schools have quite soon. And your score will be based on the appropriateness of your response to the stimuli. So there's a really broad range of metrics that they use. And I'll take you through some of these a little bit later when we talk about the different types of questions. But it's obviously very varied. It's not, like the multiple choice questions in section 3 of the GAMSAT, where it's very black and white, for example. This is very, you'll have an examiner there, you might have even a couple of examiners there, and it's very subjective based on a range of different factors. The MMI, I think, has some advantages in that if you really screw up in one station, it won't really impact you on the next one, because there'll be new people. You can just forget about the horrors that you've committed in the previous one to a different marker. And it also can be something that could possibly be fun as well, if you look past the incredible stress of the day. So the panel interview, just to be quite brief on this one, and the panel interview was actually one that I did to get into Griffith University a few years ago before they did MMIs, and then I've subsequently helped out with administering the MMIs at Griffith University for a couple of years. But the panel interview is basically, you have a number of people in front of you. I had 3 interviewers in front of me, for example, and they just go through a whole number of questions and scenarios to quiz you on. And it really does work through most of the different types of questions you would find in the MMI, although maybe the big difference is that you just stuck with the same 2 to 4 people for the entire time. That obviously has disadvantages, because if you pee people off at the start or have really bad answers at the start, you might feel like there's no redemption, and you might kind of spiral down to some kind of hopeless self-deprecation cycle when you start performing badly and there's no hopes of any different examiners. And if for example, my panel interview was quite interesting, where it was very obvious different panelists had different roles. One was really engaged and interested, another one was really nasty and expressed a lot of anger with me and was very dismissive. Another one was kind of ignoring me the entire time. So you have these kind of really interesting kind of good cop, bad cop scenarios that sometimes go on in these. I think that's all I say maybe on the panel interview for the moment. And very briefly with the group interview, because I believe maybe only ANU use this before their interviews at the moment. But it's pretty much you, and you'll be in a small room with the other interviewees. And usually they ask you to do some kind of problem solving task where they want to see you cooperate together, share the load around, make sure people don't dominate, and so forth. The disadvantage of this is, of course, that you can be dominated by other candidates, but also dominating yourself will also not look good. And interacting with others on a very stressful day can be very difficult as well. So this is one of the points of data I was just referring to, and I might just point out a few things, and then ask Tanmay if there's anything to add on this one as well. But this is maybe really just to demonstrate the different medical schools, the stations that are there, the time that you get in per station, and the time between the stations, so kind of the resting period. So the question types we have here is what we've kind of collaborated, or so not collaborated, we've researched over the last few years to kind of find out what kind of question types are being asked at different universities, and tried to compile them for you. And just because there isn't a tick somewhere doesn't mean that these question types aren't present at these universities. It's mainly just because we haven't had confirmation that they are. So for example, Monash only has a tick for ethical scenarios, and that doesn't mean they don't ask anything else except ethical scenarios. It's just that we haven't had firm confirmation of that. So this is just a bit of an indication of what's around the country, and the format might change for next year, but this is kind of the latest information that we have. It might be good to take a screenshot of this as well. It's quite useful. Tana, anything to add for this one at the moment? Or?
Yeah, I guess just like take this sort of as a guide, because like Elliot mentioned, that things can change. As well as the fact as well, sometimes that these questions don't come just by themselves. So sometimes you might have an ethical scenario presented to you, and then suddenly you'll have a why medicine question pop up as a follow-up. And they do find ways to link like different kinds of questions as well. I'm speaking to specifically for MMIs. So yeah, just a little heads up there.
Yeah, that's such a really good point, because yeah, they're not neatly delineated in each station. Just because you start going to ethical scenario doesn't mean it's not going to involve other aspects. So that's really really useful input. Thank you.
Yeah. Next one.
So I'll just maybe just briefly talk about the Griffith University process, and then Tanmay will talk about UQ. And of course, I think maybe everyone is aware, or if they're not, students, when they do the interviews, have to sign a non-disclosure form to say that they won't tell other people about what was on the exam and so forth. So our comments will of course be limited based on that. So like I said, I was in the panel interview for Griffith University, which is now quite a while ago, and I have spoken already about this, but they did change to the MMIs after I got in that year, which is a few years ago now. And I think from 2012 or so, they started doing the MMI format, and I helped with a few different rounds of that for a couple of years as a invigilator. And I think maybe the main points to say about Griffith University, which is quite interesting and different from others, is that Griffith, and just like in the medical program, they really like using actors. So they often have paid professionals there who will act in some kind of capacity as like a patient or whatever it really could be. It's very interesting, and they often are very good as well, and respond really emotionally to your cues and so forth. And so for instance, like in our medical exams, which is a little bit different, but still I guess kind of the same principle, we'd have like what are called OSCE exams, which are like practical exams. And if you said something like to the actors, like, oh, I understand your pain, like they'll go off at you and get really angry and be like, how could you possibly understand, and all this kind of stuff. So it's kind of a very similar idea in the interviews, how they interact with you as well. So yeah, it's very important to be able to interact with people, and we'll talk about preparation a little bit later on. And there's lots of different people who administer the interviews at Griffith Uni. Lots of medical doctors, mostly academic ones or older retired doctors. And there's also usually a lot of medical students involved too. Like you do lots of like kind of group work, and you'll have medical students there from the school, and you have to kind of instruct them on tasks. And that's something that was, prominently used in a lot of the interviews that I saw. And we'll talk a little bit more about the different types of questions, and I'll talk more about the Griffith experience when we discuss the preparation too. So that might be all on this one, I think.
Okay, wonderful. So for UQ, not sure if you guys were aware, but last year was the first year that they introduced interviews at all. And so this is the structure of MMI. And yeah, it's pretty much a stock standard MMI. There were no actors or things as such, just scenarios and questions. You go in and talk to the interview and then rinse and repeat, essentially. So yeah, there were 8 7-minute stations, and with 2 minutes resting/reading time. And for you guys, if you're applying next year, I think all your MMIs will be done online. So the way it'll work is you will have your laptop open and you'll just be there, and I guess the interviewers will keep switching seats. So you wouldn't have to move or anything. The interviewers themselves will move around, and it'll be the same process as you would be doing in person. Yeah, that's pretty much all I have to say about UQ.
Excellent. Yeah, it's really interesting too, because UQ used to be, the university that I maybe was most prominently the one that didn't have interviews. And we used to, at Griffith University, we used to always joke that UQ students, didn't have any empathy or ability to communicate with other people, which is why they were able to get into UQ. Might not be true now, hey, Temme.
Yeah.
But I'm sure there'll still be good banter between the medical schools as ever. So maybe, we'll just talk about now the ideal medical candidate briefly. And so this is, I think maybe just things to think about. Obviously, this isn't prescriptive of what you have to be like, and it just very much depends on what they're looking for in any given year. But these are some of the things that we've put together as some main things that they're looking for after, through our years of experience. And I think this will make also sense when we start talking about the types of stations, how they can actually see these things in you. And a lot of these are very normal for kind of any interview situation for a job or whatever it may be. Team player, communicators is very important. Being culturally sensitive, of course, is vital. And even at Griffith University, there's usually quite a strong emphasis on being able to be sensitive and understanding and empathetic of people from different cultural backgrounds, which is, of course, a vital role as a medical professional in any community. Being effective and competent, and I think for me, most importantly, I think it's kind of the empathetic aspect. Being able to be with someone who's grieving, being able to maybe calm down an angry person, or just being able to understand human emotions, which I think maybe was the most important aspect for me for my medical school interview and what I saw in other candidates. So I think for me, this is terribly important. Tanmay, anything for you to add there?
No, that's all good. Yeah, that's
awesome. So like before, this is also not prescriptive, but I think, some things that hopefully should be pretty obvious of what you should do on the day and what you should definitely not. So the first doing part is make sure you dress appropriately. So this might sound quite silly, but I remember when I went to my Griffith University interview, I 100% can guarantee that I saw someone in board shorts and what do you call them, thongs as well. It was, the Griffith University is on the Gold Coast, so there's definitely a more relaxed atmosphere. But that I think was probably not an appropriate way of dressing. And now I think, I don't know what you think of this, Tanmay, but I think, I don't know if clinical attire is the right term to use. I know some people wore like suit jackets for men and ties and so forth. Some people didn't.
Yeah, it's interesting because I remember thinking about this question exactly as well, and I was like, oh, what should I wear? What's appropriate? And usually the guide is that wear clinical attire, like at least for the boys, like they were wearing full-on suits and stuff. I personally rocked up just in clinical clothes, so like chinos and a shirt, like no tie, nothing. So I guess just dress smartly and dress appropriately is probably the best way to go.
Yeah, that's a really good point too, Tanmay. Thank you for outlining what clinical dress is, because I think maybe not everyone would know exactly what that means. So you don't have to wear a suit and tie and top hat if you're a guy. And even though I maybe don't feel like it's totally appropriate for me to say what might be expected for ladies, for example, but I do know from when I was on the invigilator side of things, normally examiners would comment if there was maybe, again, I think you have to consider that a lot of the examiners are quite conservative older doctors. So for men or for women, a lot of like skin showing, things that are too short in some places, having inappropriate footwear you wouldn't wear in the hospital would be things I'd probably try to avoid for both genders. Maybe we'll just pop back there just for a second. Sorry, Tanmay. No, that's all right. Just very briefly, some of the other things that I just wanted to quickly point out is that in each station MMI, you should ideally introduce yourself to the interviewers if it's appropriate. Sometimes you'll find that some stations, it'll ask you to ignore the interview and you have to interact with, what's in the room. but sometimes, if there's some, for example, just an interviewer in the room who's asking you a question, it's good to introduce yourself in whatever way that, would be possible in the, COVID situation, whether it's shaking your hand or not, or, whatever. Articulating yourself well is, of course, really important. One of the things I do look for, I think, is, making sure you're not repeating, prepared statements for questions, but you also, I really think this is a big no-no. So it's, in the don't category to make, trying to memorize answers, but you also have to, I guess, practice enough that you can articulate yourself well in answering the questions that might come up. And we'll talk about this a little bit more later. So yeah, approach the question using a framework is obviously really important. Maybe that's all I'll say. Tan May, was anything you wanted to add to this?
Yeah, I think that's really good advice. Like be well prepared, but don't have memorize, don't learn answers. I think
thought you saw people do badly or well.
Sorry. Yeah. That's exactly right. Because if you think about it being on the other side, if you sort of listen to just a pre-prepared rote learn response, it's not as good as if you're just kind of being a bit more genuine and natural. And so I think sort of my advice would be is, for example, for the questions which more commonly appear, have a general guide as to what you will talk about, but don't necessarily script every word. But again, it depends on the individual and depends upon what makes you feel comfortable and what makes you feel prepared.
Yeah, absolutely. Thank you so much.
Yeah.
So we'll talk about some of the question types now. And again, at the end of this brief discussion, there'll be a bit of a summary that you can take away from this too. And we'll maybe talk through a couple of these as well in the next few slides about how you go about approaching them, how you might think about trying to answer them, for example. In terms of the types of questions, maybe we'll start out by describing the ethical scenarios. So these are ones that are quite tricky to approach, and they might be, for example, you're sitting on a plane and for some reason you have to decide between giving a part of a liver to a sweet innocent old little girl, or someone who's a violent drug dealer or something like this, and you have to talk about the ethics of how you distribute that liver, for example. A very common one is the motivation to study medicine. And I think, probably everyone has been asked this so far. And if you haven't, you certainly will be a lot. Why on earth do you want to do this to yourself? Why do you want to be a doctor? And articulating yourself in that manner is very important. For the science knowledge, this one's a common one actually down in Melbourne University, for example. If anyone's thinking of applying there, I've heard this is a very common question where you're asked by the examiner to explain something like, what's the gene? What's a cell? Can you explain this concept to me, for example? And obviously, the point is to demonstrate that you can communicate complicated health information to someone who is a lay person who doesn't have specialist clinical knowledge. And health knowledge, these stations are designed to test your understanding of complex health issues in Australia. So, for instance, I remember a few years at Griffith University, they asked quite a bit about refugee health because it's a very topical issue at that time, and obviously still is. And, I kind of think to myself, if I was a medical school, I'd be thinking about asking stuff about, COVID, for example, or pandemic medicine, things like that. And it's again, I want to emphasize, it's not something you don't have to be a clinical physician to be able to answer these, but it'll be kind of broad public health type questions. It might be broad, public health type funding questions is one that I got in my panel. Yeah. So the behavioral questions, we might have, they're kind of better to demonstrate through examples, and we'll talk about them soon, but it's kind of just generally to find out, who you are as a person. They can sometimes be quite similar to the ethical situations, I find, because, a lot of it's kind of about finding out, your moral compass, for example, how you respond to certain situations. So they can overlap quite a bit. Practical tasks and puzzles is something that I don't know about UQ or other medical schools, but I can say it is something that is a favorite of Griffith University. And often, you might have it as students, or you'll go into a room, there'll be, people sitting down, there'll be a puzzle piece, for example, and you have to kind of instruct them to put it together. Or you might have to instruct people on how to draw a picture, for example. And so it's kind of demonstrating some leadership, some group work, teamwork, and that kind of thing. And just like we said before, the group work is one that is before the ANU exam. So we won't really talk about it that much, I don't think, because it's not really relevant too much for this evening. So this is an example of an ethical scenario that you might be hit with. And maybe what I'll do is I'll just read it out to you and talk to you broadly about it before I just see if anyone's put any questions or comments on Facebook. Because again, if you want to contact us and ask anything, please write it on the Facebook stream and we'll do our best to answer them. I'll read this out, have a look at the Facebook stream, and maybe put it on 10 May to start thinking about how you would answer this ethical scenario, because I'm a lawyer as well, so I'm not a very ethical person. So a friend has told you that she's pregnant and that she hasn't told anyone else and will possibly seek a termination. One day in class, she becomes unwell and your tutor asks you if she's pregnant. How do you respond really? And so this might be all of the kind of information you get on the door, maybe in the way to the station, or that you're being given to think about. And we've just put a few different questions here that might also be follow-up questions the examiner might ask you, or at least things that you need to think about. So Tanmay, I don't know if you're comfortable to maybe guide people through the first one, and I'll just quickly pop onto the old Facebook page, see if anyone's asked any questions.
Yeah, sure. So I think even before delving into the questions, I think first, after you read the scenario, this is outside the door, or well, in your case, just during your reading time, I think first of all, it's important to take a step back and orient yourself to the situation. So first sort of understand what's your role within the situation. Are you a friend? Are you a family member? Are you a doctor? Are you just understand your role, and then understand the people and the stakeholders involved in the situation. So for example, in this scenario, we're a friend to a girl, and we're presumably in a university setting. So it's really important to understand not only the context, but also the nature of the relationship. So in this case, the very fact that you have been the friend that she has told you this information, you should start to think that this relationship is one of like a really close friendship. And so evidently she's trusts you quite a bit, and that's why she has sort of told you about this, about her pregnancy. And so sort of when you start to answer the question, what sometimes I find useful is taking like maybe around 10 to 20 seconds just to summarize what the situation is, because it not only tells the examiner that you have understood the situation, but it also gives you time to sort of articulate a response and then delve into the issues. So for some scenarios, you might get a prompt, what issues are involved? For some scenarios, you might not. However, I recommend just after your little like summary, go straight into the issues. So for example, in this, okay, so often when thinking about issues to do with an ethical scenario, what I find useful is using some sort of ethical framework. So I don't know if you're familiar, but usually using 4 to 5 ethical principles such as autonomy, beneficence, non-maleficence, justice, and confidentiality. Often, if you sort of kind of use that as a framework to articulate your response, you often cover quite a lot of ground, and it allows you to sort of put out a really comprehensive answer. So yeah, so with this question, so let's go through the first one. What issues are involved? So first things first is there's an issue of confidentiality, right? So because the tutor has asked you if she's pregnant, and you know that she's pregnant, but obviously, you know, you have a kind of duty in that she's only told you, and she's told you because she wants it to be sort of kept between you two. So that's one issue. And then the other issue as well is she's potentially unwell, and this episode could be related to a pregnancy. So it would be important for all those who are sort of taking care of her or who are going to respond to a situation to know that what issues is she experiencing and what's sort of her history. So I think it's important also when doing this ethical question, when answering ethical questions, make sure you highlight both sides of the story, because it kind of shows to the assessor or to the interviewer that you're able to reason on both sides, you're able to understand both sides, and that sort of ticks off key attributes like being empathetic, being sort of able to, understand both sides of the situation. And I think also what some people sometimes hesitate to do is take a side. Like after discussing both sides of the coin, they hesitate to go for one of the answers. I mean, Elliot can probably speak to this because he's been on the other side as well. But I think it's okay to take one side as long as you highlight the potential issues or potential things to be sort of careful about. So for example, with this, if you, after outlining both sides, you say that, since this is about her health and so in order to prevent harm from befalling her, it would be in her best interest to probably let the tutor know that she is pregnant. And then after that, you don't have to stop there, but rather I'd encourage you to say another statement like, however, we would have to be sort of cautious that the situation and the gravity of this situation actually truly demands that you reveal this sort of information. And yeah, so I think doing sort of that would really help to give, a good answer.
Yeah, excellent, Tanmay. And I think, all the points that you discussed there are just really vital. And I really wanted to pick up on one of the things that I think you said, which is so fundamentally important to answering every one of these questions, is that thing of repeating back to the examiner, how you've understood the situation or what you understand from the question. Because firstly, it absolutely demonstrates that, you've been listening, you understand what you need to answer. It also demonstrates that, you, I guess, comprehend, the issues involved. And it also gives you a bit of time to think about how you need to respond. And this is also something, in your medical school exams that I used to do all the time, because it just gave me a few seconds to actually think about what I'm going to do next. Because if you just launch into an answer, it can seem very unstructured, unsystematic, and all over the place. So it's really good just to repeat back to the examiner what you understand the scenario to be, and just give you some more time to then structure your answers. And I think the ethical framework that you presented is really perfect, Tanmay, and it's a very complicated one. And from my perspective to your question of how to actually practically respond to these types of questions, I think what generally is looked for in this is that you do deal with both sides of the ethical equation. For example, so for the second one, a paramedic is attending to ask if she was pregnant, etc. You would have to, I think, actively weigh up, like, okay, we've got this issue of confidentiality. Here are some things we're going to talk about that. Here's maybe the duties that I have as a friend to her. And then you might have to weigh up, okay, well, there might be some kind of potential health issue here, and we don't want to do harm. We want to do what's best for my friend. So these are the other issues that I consider around this. And of course, always be aware of information that's not given. So for instance, just, in class, she becomes unwell. She might just get a slight headache. It doesn't mean that she's going to die or anything. And if you just suddenly say, oh, she's pregnant to the class, even though she's got a mild headache or something, that's kind of something you obviously wouldn't do. So always think about, okay, what information do I need? And don't be scared of actually saying that. I'm not entirely sure of the situation. I'm not certain about this part of the information I'd want to, find out more. For example, this is, something you can absolutely do, and you're not going to get marked down for it, for example. So yeah, I think maybe that's all we'll say on that. Hey, Tanmay, I think we're not going to, do the question as such, but maybe just get you all to think about the important aspects. So this is one of the questions I actually got in my panel, and when I got it, I thought like, oh damn it, they're not going to accept me, and which was like, what do you two intend to do if you do not get accepted into medicine this year? And normally it's not to indicate to you that you haven't got in, because obviously that's not the case. But when in a very stressful time, you might think that. But it's just kind of to get, I guess, an idea that you have some kind of forward planning. I think for me, this is kind of what they want to see, that you have different pathways ahead for yourself in terms of career planning, but also in terms of just general, I guess maybe you'd call it like logical reasoning, like thinking about, okay, I want to get from A to B, but if we can't do that, then we're going to go C and D and then back to B, or something like that. So I think you definitely should expect some kind of question around the motivation to study medicine. Tanmay, anything to add?
Yeah, for sure. I was under this wrong impression that since it's MMI, I wouldn't get this question, and this question just sprung up on me, and I was like, oh, and I totally froze. But I mean, I didn't freeze completely, but I did sort of give off an answer, and luckily it was towards the end of the station, so I got away with it. But yeah, just do make sure that you have some sort of outline as to how you would respond to this question, and it really comes back down to taking the time just to reflect. Honestly, reflect on yourself and your values. Why are you here? Why are you doing this? Because, applying for medicine is such a long process and such a intellectually as well as financially consuming process. So why are you doing this? And just, I guess, sort of taking the time to sort of look introspectively is very helpful for these sort of personal and behavioral type questions.
Yeah, awesome, Tanmay, thank you.
Yeah.
So this is, what the example I gave earlier in the presentation about the scientific explanations. And generally, I think from what I've heard, especially at Melbourne-based universities, you might get a piece of paper which has like 3 different terms on it, and you kind of pick one that you'd like to explain to the examiner. It's really to, I think, obviously, make sure that you can deconstruct complex terms for a simple audience, because I think there's a really big problem in medicine still, that a lot of doctors often don't speak at a level that is understandable by all and use a lot of jargon, for instance. And even when we have practice interview scenarios at the Interview Ready course at GradReady, we usually do these kind of questions to get people to actually practice explaining them. And students from a natural sciences background always have a surprisingly incredibly hard time doing this without using any kind of scientific mumbo jumbo, as you might call it. So it can be one that seems quite easy to do, but in the heat of the moment, in the stress of the time that you have when you're answering this, your brain might switch back to mitochondria and all kinds of technical terminology, for example.
Yeah, I completely agree. Like, these sort of questions are not to test how much knowledge you have, but rather how you communicate that information. Like Elliot was mentioning, it's about how well you can appropriately sort of express that information in a user-friendly method.
Yeah, and I think like they've done the GAMSAT to kind of demonstrate your knowledge of natural sciences. So this isn't. I remember like the grading sheets for this is really, knowledge is barely on there. It's just how you actually communicate to someone. And then you're never going to have to explain anything that's super duper complicated. So don't worry about having to revise any of the natural sciences before going into this. Oh, yeah, let's move on. So yeah, the health knowledge aspects are maybe the ones that you might have to prepare the most for in a way. And I remember, I think I said this before, that a few years at Griffith University, refugee health was a large focus, but Indigenous health has of course been a prominent type of question. And I suggested before, for this year, I really wouldn't be surprised if there's questions of health knowledge around epidemic medicine, for example, or the public health of epidemics and COVID and so forth. I think, for me, like at Griffith University, and I think at other universities which are very focused on, like broader public health, global health areas, like I think Wollongong, the Notre Dame universities are very interested in this, this kind of questions as well in their interviews. There's another one I had in my mind. I can't quite remember it at the moment, but yeah, I think you definitely should expect these, especially at Griffith too. They ask this quite a bit as well. Tanmay, anything to add to this one about maybe how to prepare or how to think about this?
Yeah, so I think it's really cool that we have an interview and interviewee perspective to this. Like I think it's quite useful to like people listening in. So this is really cool. But I think from the student perspective, I think it's don't get too worked up about like trying to read up on every single health issue out there. Just sort of have a general understanding of the broad topics like Elliot mentioned. So Indigenous health, rural health, and also depending on the university you're applying to and depending on the university you're sitting your interview at, maybe think about the local context there, whether it be in Queensland or Melbourne or just anywhere. And yeah, like Elliot mentioned, I wouldn't be surprised if a pandemic type question did come for this sort of question, for this sort of format. Yeah.
And for me, I think these are one of the types of questions you really have to actively prepare for. And if you look at a question like this and you're not sure, then this is an indicator to you that this is something you probably do need to prepare quite a bit for the interview. And we'll talk about preparation soon as well. So maybe we'll go on the next slide. Okay, so this is an example of a behavioural type question, and I think I definitely got this one or very similar. When was the last time you displayed leadership? And for these types of questions, they also can be very tricky as well. And I think for me, my advice for this kind of station is to try to, I think, differentiate your answer maybe from others, because I generally have found in all of our practice sessions with Interview Ready and also seeing it at Griffith University, a lot of people talk about, leadership in a group assignment at university. There's kind of the classic example over and over and over again. If you can have something outside of that, I think that's very positive. And I think another aspect of this, the behavioral type question, which is really important, is that it's actually an opportunity for you to, and I hate using this term, but to sell yourself, to demonstrate, I've worked in these areas. This is where I had, leadership experience here. These are, my achievements in this and so forth. So, don't be shy about offering that information up to try to, demonstrate fully and try not to sell yourself short. I think it's generally quite uncomfortable, I think, that I found with a lot of candidates to actually talk yourself up a bit, because it's not something you may be used to doing. But when you're answering questions like this around the behavioral aspect, it's really important to try to integrate, as much as you're in your life as you can, I think, to really help answer this at a deeper level.
Yeah, sort of what I found helpful when preparing for these questions was literally just obviously before the interviews, just list all the traits that are essential to being a good doctor or a good medical student. Just list them out on a Word doc or whatever method you see fit. And you can even use the internet for help, or even go to the university's website and check out what they say. And for each of those sort of traits, just brainstorm some examples, / times where you've displayed those traits, so that you sort of have like a bank of experiences you can draw upon when required to in the interview. Because I think, sort of having that bank behind you is really helpful, especially in stressful situations when they might just bring up that question that they might go from an ethical scenario to, oh, when is the time you've displayed leadership? And then having those prepared almost examples would be really helpful. And so, just sort of reflect on all the work you've done any university experience, personal or extracurricular. But like, don't stress if you don't have something cool, like, you know, if you're not a state champion or not. Like I didn't have anything special or out of this world. So it's like absolutely fine to have normal situations. I guess it's just the way you sort of present that information and the way you link that situation to the ideal attributes of a good doctor.
Yeah, absolutely. And I think, yeah, you know, I'm exactly the same. I definitely didn't have anything special, so-called, you know, about me before going into this kind of question. But I think it's just about thinking about the so-called, you know, every day, about what we do every day, and actually finding aspects of leadership or aspects of teamwork within that, and describing it in a, you know, in an interesting and engaging way. I think maybe is the art of this question. But we can move on. Okay, so this is an example of the practical task, and I mentioned this is Griffith University does like to do these ones with, you know, with actors, for example. A lot of other universities also, you know, do the practical task quite commonly, where you might have to, you know, instruct people to do a task. You might have to participate in the task as well, and there usually will be you know, instructions such as this, where person one will be given a sample drawing, then must describe this drawing to another person. So usually I think you're person one normally in this situation. And then person two must try to recreate the drawing based on the instructions from person one. Yeah, this one's usually quite a bit of fun, really. There's often, you know, maybe medical students who are the ones you have to instruct and direct. But yeah, it's a really broad range. You might have to put puzzles together, you know, draw things like this one does, or yeah, I don't know if any other particular examples that jump to mind, but it's a really interesting one. Tan, maybe do you have anything to add?
Yeah, look, it's not a common task that universities often employ. I think it's just select universities, and maybe Griffith does, but I'm not aware that UQ does this thing. But again, things might change given that last year was the first year. I think if you do sort of get this, put the emphasis on like the traits you display. So rather than trying to complete the task and trying to complete it successfully and basically doing anything you can just to get it done, just be, yeah, sort of just focus on the communication and interpersonal skills you want to demonstrate to the interviewer. I think that's the main objective of this task.
Yeah, that's such a really excellent and valuable point, Tan, maybe, because, you know, I and you really got to bring these things up that I remember from my own experiences too, and seeing students trying to like aggressively, almost like force the other people to finish the task of what, you know, they were instructed to do. But of course, you know, just like you said, the whole point of this is actually the communication, you know, even the empathy, the human engagement. It's not about completing the task really at all. So yeah, that's a wonderful point. Thank you for making that, Tanmay.
No worries.
So this is one, again, this is kind of like the so-called ANU special. I think we had it listed on our slides, but this is a thing that's is really quite specific for the Australian National University in Canberra. So it's not something we'll talk too much on, and something, you know, I don't have specific personal experience with, but it's generally, just like we said, before the MMI interviews, which I think they do, they'll have like a group work scenario where they will you know, get all the candidates in a room. You'll have to, you know, design an intervention, for example, or do some other group task where you have to work together, have to, you know, ensure everyone else has, you know, an equal say, you don't dominate, etc., and, you know, and so forth. Tanmay, do you have anything to add to this one? It's a bit of a peculiar one.
Yeah, like again, it's like a really ANU probably specific thing. I'm not sure if many other universities would take this up, just maybe due to lack of standardization or whatnot. I'm not really sure, but I think if you do get it, the key things to sort of be aware is that they're trying to assess your ability to collaborate with others, teamwork, because that's such an important part of being in the health profession. Your ability to demonstrate leadership, but not dominate, but just demonstrate a bit of leadership, bit of initiative. The way you communicate and interact with others, they'll be observing that quite keenly. Your ability to time management, stay focused on the task or intervention, and just demonstrating professionalism. Really, like, yeah, just not, yeah, just the basic traits really.
Excellent. Thank you very much. Let's move on from this one. So this is just a couple of words about the online interviews. I think Hannah, you mentioned that UQ are doing an online interview next year. Is that right?
Yeah, just keep your eyes peeled out for any communication from the faculty or whoever's managing the interviews. But what I saw, they're planning to have interviews for graduate entry people, but just keep an eye on the page, or just, yeah.
Yeah, this is something that you'll definitely need to be aware of over the coming months. And the interview ready courses that we're running as well at GradReady are focused on the online interviews, because we're kind of assuming that most of them will be online because of the COVID situation, and a lot of students usually go interstate for medical school. So, I think these are probably pretty obvious things that you should do for the online interview, like make sure your computer, you do a test run, make sure the lighting's good, you've got a good spot, maybe have books behind you, make you look smart, for example, and you have other, different equipment that you need, like a headset, for instance, which might help and ensure that you're, I guess, as much as you can, be isolated from housemates, family, pets, and so forth. And I think this is going to, I think one of this point is kind of, I think, the most challenging for universities, because of course, like, a lot of people don't have a place in their home where they can be isolated from others, or they've got a lot of caring responsibilities, which makes this really difficult, or the internet connection isn't good enough, for this. So these are equity issues that the university might have to sort out. And I kind of imagine that they will surely have some kind of backup of like telephone conferencing or something if online stuff doesn't work, because the NBN isn't very good. So connectivity might be a problem, but I'm not sure.
Yeah, definitely get it. Like, if you do need some sort of like some equipment or just like special provision, just do get in contact with maybe GEMSES or just the faculty as soon as possible, just to find out what the process is, what adjustments they can make if you do require some sort of assistance with that in that space.
Yeah, that's a really good point, Tanmay. And how about we'll move on from this slide. Okay, so this is just a bit of discussion about the scoring of the interviews. And again, this is very diverse at different medical schools, and this is just a broad overview of what you might expect to be scored against for your candidacy in the interview process. And again, we'll just kind of touch on these briefly, and then we'll have some data at the end, I think, which will be more useful about the interviews in general. So the content, so how the appropriateness of your response to, for instance, the ethical scenario, that you're bringing up different ethical things to think about. You're thinking about from different sides. For example, we kind of go towards a content score, thinking about what's involved, what's at play, what you need to consider, and so forth. Just like we've kept emphasizing over the course of this seminar, and especially what, Tanmay said before, the structure is really important, that you give yourself some time to actually articulate a response to a question, that you don't just kind of blurt out what's on your mind first. You maybe repeat the question that's been asked for you, give yourself some time to think about, okay, how will I structure my responses to this, because you have to really help the examiner out here and actually give some signposting of what you're going to address, and the number of important things you're going to consider in your answer, and take them through that step by step. The most important thing for me still is empathy. Demonstrating, I think, appropriateness of human connectivity, social relations between people, being able to understand and empathize with human emotions, respect for diversity. All of this is incredibly important. And, I think at the basic level, your presentation, your manner, so that you're appropriately dressed, that you're making appropriate eye contact, and you use, hands and stuff to explain things, but not over the top. All this stuff goes to your presentation and manner. Tanmay, anything to add for this one?
No, I think for me, what personally helped me the most was having some sort of broad, like a structure, like a general framework, especially for the ethical questions and the behavioral questions. So I think just thinking about it beforehand, how you would like to approach it would be very useful. It definitely helped me quite a bit when I was actually doing my interview. So I would strongly recommend that you come up with a broad structure.
Excellent. And I see we're getting a couple of questions on the Facebook stream. So keep them coming through, and maybe we'll have some time at the end to address them as well. So we'll just have a brief couple of words about preparation, which is obviously, incredibly important, as we've kind of described to you in terms of the types of questions. All of these actually do require some preparation. Even for your instance, like, why do you want to do medicine? You might have a particular idea in mind about why you want to do medicine, which is exactly, what you should be communicating, but actually preparing how to structure this, how to, communicate that articulately and eloquently is really, really important. So you really can practice for every type of question, and I really think that you should. And I spent a lot of time myself preparing for all types of questions that I thought I might get. Some of the preparation you can do is, attend seminars like this where you hear from previous students. We've got a few other ones from GradReady coming up over the next week or so. The GradReady page obviously has a lot of different content that will also be helpful for you, as well as blogs and so forth, where you hear from previous medical students on their experiences. And those for you who aren't aware, pagingdoctor.net is a really excellent website, which has a lot of things you need to think about, a lot of example questions. And I pretty much use Paging Doctor for a vast majority of my preparation, and it was really wonderful. If you find yourself you're someone who does a lot of ums and and these kind of things, it can be a good idea to, well, firstly, you should really try to cut these out. Just in general, it's good, and I'm always really conscious of myself, and I have been doing a little bit in this seminar. So, but if you want to, really try to fix this, I found it really helpful for me to, record myself and then actually mark down every time that I did an or a like, or the knows, for example. And that really helped me cut down these kind of annoying empty words. Doing it with peers is also really good to critique each other, give yourself feedback in the mirror is also helpful, of course, as well. And, just like we've said, during this, preparation is really important, but you're not supposed to go in and actually try to regurgitate things that you've memorized. But for me, for my interview, I did write down responses for all the questions that I thought that I might get, mainly for me to reflect on. I never once tried to regurgitate these, but it's just, I think the process of actually trying to put them down on paper really helped me in my mind synthesize actually how I'd go through these. And just one of the things that I'll just briefly say before I let Tan may also add to this is that for me, I was interviewing at Griffith University and I lived in Brisbane. And so the day before, I made sure that I went to the venue where it was going to be held. I walked there and made sure I could get there okay. I knew the transport routes and so forth, got to the location, stayed there for a little bit, got comfortable with the surroundings. And so I think this is really important. And I went there with my, the full dress on just to practice doing it. I think that can be a really good confidence booster. And Tanmay, anything to add for this one?
Yeah, just on that last point, definitely visit the location the day before or however long before, just to get an idea of the place, where you have to go, and so that it's not as daunting on the day. But yeah, basically what Elliot said is, basically, no, I don't really have anything else to add. Yeah, it's all good.
Excellent. So let's move on to the next slide. So I think we're almost nearly at the end of the slides, actually. And what we might do now is I'll just
Oh, you're on mute, Elliot.
I just muted myself. Sorry. I don't know why I think I'm used to muting myself when I go look at the Facebook stream, and I did that again. So apologies. But I'll take us, Tanmay, maybe I'll just read out some of the questions that we have, and then we can respond to them. So the first question here from Suleiman. Good evening. Will the online version of MMIs potentially limit the scope, style of stations or questions? And Tanmay, do you have any thoughts about that before I say my piece?
With just from previous year, all the questions that were presented could be done just by a conversation. So look, Potentially, yeah, the scope for change might not be there, but in terms of the style of questions, I think you could reasonably expect more questions that are centered around you talking and having a conversation. So behavioral, ethical question, and less of that group work sort of task work thing.
Mm.
Because also UQ is well rehearsed in doing online interviews because they attract a massive international crowd, and they have a huge Oshner crowd, which so all of them do their interviews online. So yeah, in terms of style of questions, in that sense, I guess there'll be a heavier focus on scenario type questions. Yeah.
Mm. Yeah, and from my perspective, we've been designing the interview ready course here at GradReady, and when we've been able to redesign all of our scenarios for the online format. So, if we can turn it around and make it relatively still, quite similar content, I think we should expect really not too vastly, change in these things. Except just like Tanmay said, the group stuff might be tricky, although I still probably wouldn't rule that out either. And we're going to have practice stations as well for some group work too. And even like, with actors, I think you could still do that on Zoom, for instance, like, getting someone to try to instruct them to draw a picture on a whiteboard on Zoom, I think is really manageable as well. So yeah, it might limit some aspects, but I really would still prepare fully for everything if you can. And I'll just go to another question as well. Just 1 second. So we've got 2 questions from Radhika. So first, I'll just start with the MMI related one. So actually, I'll probably just answer this. Radhika's question is, how do you expect universities would conduct group work or practical class and online interviews? So we did just mention about that. Sorry. So it might not be something they do as much as before, but I still think it's something that you should not necessarily write off. And the other question that Radhika had was just a little bit outside of the MMIs. How much assumed knowledge does the MD or the medical course require? So for me, I would say very little, like not not entirely little, but in terms of what you need to know to get into MD is really not a great deal. Like we, for instance, have a lot of people who joined our MBBS program or a Bachelor of Medicine program who are from really diverse backgrounds, who are from computer science, from literature, from, all kinds of different places, and everyone was pretty much on the same level after 6 months. And for Griffith University, they took us through the basic sciences and physiology of everything at a really basic level from the start. So yeah, you really don't need to know a great deal, and I don't think you really should not be preparing for medical school in the summer. I just, as I want to say, I know some people do that, and I really would recommend that you don't, and just enjoy the break that you have before going to medical school. Tanmay, did you have anything to add to that about assumed knowledge before going to medical school?
Yeah, look, definitely the thing with MMIs is they basically want to assess not your knowledge, but your interpersonal skills. So they will definitely make the questions such that a person from the humanities can answer to almost the same standard as someone who's come from a science background, especially for Griffith and UQ, which don't have prerequisites as far as I'm aware. So the very fact that they don't have prerequisites means that they are expecting people from all sorts of backgrounds. So with that sort of thinking, you can expect that the question will not assume that you know certain concepts or certain terminology. But having said that, things like health issues and ethical scenarios to do maybe within the health context, maybe the science people might have practiced it at some point. So I guess in that sense, just sort of read up on that, like we were saying, just to prepare, read up on the main issues that are affecting the Australian healthcare system. And that's probably the only sort of preparation I would say in terms of assumed knowledge you would require.
Yeah, excellent. And we have a couple of questions about, I guess, non-graduate entry. And it might not, I don't know, it might not be something we might not be able to answer in the full, but this is a question from Matilda. Are graduate entry and non-grad entry interviews different? Tanmay, you might be able to correct me on this, but I never considered them to be different as such. Even when I was at Griffith, I thought we had graduate and non-graduate cohorts actually in similar interviews, but this might be different based on different med schools, but I'm not entirely sure. Tanmay, did you have anything to add to that?
If anything, it would more likely be uni dependent. So like, for example, if I compared a post-grad MMI to an undergrad MMI, and if they have like a similar emphasis and a similar way of delivering stuff, then like it will be the same. It more depends upon the uni and what kind of questions they like to emphasize on. So especially for the undergraduate pathway, since you can sit multiple interviews, you want to actually look at each of the schools individually and see what they like, what they don't like. Like, for example, well, actually JCU doesn't have interviews, but they'll have a huge focus on rural and tropical medicine. So with the undergraduate pathway, you would have to investigate sort of the schools individually. With the graduate pathway, since everything's under GAMCES, except for UCID and Flinders, I think, the questions will be quite similar, but obviously universities will have a bit of variation in the way they assess for certain traits. But then again, it comes back down to sort of being prepared for all kinds of questions. And if you sort of do the preparation beforehand, like you would be fine.
Yeah, excellent. And maybe on a similar note, and you know, we apologize, might not be something we'll answer in full, but from Angel, I have a question. What do you recommend for students intending on going into medicine from high school? What sort of process should someone prepare for? So from my experience back in the day, people who came from high school usually I think would do the 2-year pre-med science course. And then at the end of that, I think they might just have to, get a certain GPA or something to be able to go into medicine. There might be an interview depending on the university. But from high school, I'm not too sure. Like, for instance, for me, I didn't think of going to medicine while I was still in high school. It definitely was not something that was on the cards at all. And I think what I might just say is that there's lots of ways to get into medicine. If you don't go through the I can't remember that process, the UMAT, for instance, if that's still going, if you don't go through that process, there's lots of other pathways, of course. Tanmay, did you have anything to add to this? I'm not really answering it that well. But
Yeah, no, I was just thinking. So I just wanted to clarify. So was she saying like, what can I do now to improve my chances? Was that kind of the idea of the question?
I think maybe Angel said, and hopefully they can type some more clarification, but I think maybe the process for a student in high school to get into medicine, and as well as what sort of preparations should they make.
Okay.
So yeah, I think the process, and this might be something I haven't really looked too much at, because we've focused quite a bit on post-grad things, but I think the UMAT is still a test that goes on that occurs at the end of high school, I think, and it's a very different test from the GAMSAT. It's completely different, and I think you just need to pass that, get a certain OP if you're in Queensland, or ATAR if you're down south, I think it's called. And then you're able to usually enter, I think, a 2-year science preparation course before going to medicine. That's the process from what I understand it to be anyway. In terms of preparations, I think probably just studying hard and trying to do very well, something that I didn't do in high school. So I don't know. Yeah, I think, I don't know if Tanmay, if you want to add anything more constructive than I had for that, but
yeah, I mean,
sure. Yeah.
Maybe if you'd like to do some maybe like volunteer work or just get some experience out, like just sort of things you could maybe mention in the interview. for things you can mention in an interview, maybe that's something you might want to consider. But even then, like it's not an absolute essential. Like I know I didn't have, I only had like, yeah, volunteering experience. That's the only thing I had behind me, and just general other experiences like sport and stuff and work. So
Yeah, that's actually such an awesome point, Tanmay. I wanted to bring that up before. You know, especially for people who might not be sitting an interview this year or thinking about it in the future, or if they have time. You know, for me, I found the most important preparation in a way was the years of work that I also did. You know, I worked in hospitality, for example, and as one of my jobs that I had, and I found that you know, dealing with people, you know, like on a regular everyday basis and really difficult situations, you know, dealing with drunk Queenslanders and so forth at pubs and such was really challenging and really helped stretch my you know, empathy to all new levels. So I found that was actually probably, you know, some of the best experience that I had. So, you know, having a casual job, I think, you know, this climate is incredibly hard to any kind of work at the moment, but if you can get some, you know, casual work, I think is really useful, not so much to talk about as such, but to actually help you engage and communicate and empathize with people, is really important if it's something that you haven't done before. Volunteering, I think, is also a really good idea too, and demonstrates that you want to you know, serve the community, which I think is a really important aspect of the doctor. But just like Tanya said, it's not something that's really essential. And I think for me, the value is more in building yourself as a holistic person in, you know, coming to medical school. So they're all the questions at the moment that I can see. So maybe we'll just move on to the next slide, if there is a next slide. Oh, there is. Okay, so I'll just briefly speak on this. GradReady do offer a millennial scholarship. It's called the 2020 Millennial Scholarship. Where you can just go onto our website and and apply for this scholarship, which means that you could get a full fee GradReady attendance comprehensive course worth nearly $1,500, as well as $500 cash. So it's completely free to apply for. There's no obligations that you have to do on your part, and it's something I think you might as well just throw your hat into the ring for. And that closes on the 25th of October. And maybe, I don't know if we have a next slide on this at all, Tanmay, but I just wanted to briefly say too that we are starting our interview ready courses over the next couple of weeks, I believe. So if you're interested in interview ready and interview preparation, you can message the GradReady Facebook page for more information. I'll be heading a couple of streams of that. We have a lot of really excellent tutors who are, you know, from medical backgrounds, who are doctors and lawyers as well, and some of the examiners too. And it's a really, you know, strong program. We've adapted it for the online interviews as well. So if you have any questions about that, just Facebook message the GradReady page and someone can get back to you. And very briefly, you know, I would just demonstrate the statistic that we always try, you know, our utmost to improve. I think not only the scores for GAMSAT and the interviews for our students, but, you know, for me, for the humanities and the interviews, we really try to build students up as, you know, holistic people and try to actually, you know, improve them as future doctors as well. For me and the rest of the team in GradReady, you know, we have it really on ourselves to prepare you for the medical student world and to be a doctor in the future as well. So we're really passionate about our cause, and if you have any questions at all, if we can assist, please send the GradReady Facebook page a message, and yeah, one of our staff will get back to you. That might be it. Is that it, Tanmay?
I think there may have been a question. I'm not sure if you answered, but Radhika asks, except for addressing the interviews at the state's universities, are there any difference between the different ACE interview sessions?
Yeah, thank you so much, Tanmay. Sorry. Yes, so Radhika had another good question. So this next coming week we have a few different ACE interview sessions. You'll generally have different presenters for each one. who will all have different perspectives on the medical school interview and have different experiences from themselves they can draw on as well. And each of those ACE interview sessions will also have specific university information too. So I think it is still worthwhile going to for different perspectives, because a lot of these I think can be very valuable for those of you who are wanting to sit the interview quite soon. But yeah, I think maybe they're the main differences. I unfortunately, will be in a couple of them as well, but usually more of a sidekick kind of role and in the background. So we'll have some other really excellent presenters too at those ones. But I think that's it. And I just want to say thank you everyone for joining us here at GradReady from me and Tanmay and I. I want to wish you best of luck for the upcoming months. Getting to medical school is probably the worst year ever. So I wish you all the best, and hopefully we'll see you again soon. So yeah, bye everyone. Bye.